Good evening, everybody. My name is Dr. Chris Bird. I'm here to talk to you on behalf of the Coastal Bend COVID-19 Task Force to deliver our weekly pandemic report. Task Force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. There are currently several interventions in place. You're encouraged to stay at home if you can, or stay away from enclosed public spaces. It's perfectly okay to go outside and go for a walk and go for a drive in your car and things like that. There's a executive order issued by the governor of Texas for face coverings and social distancing to be maintained in public areas. You're encouraged to isolate when you're exposed to somebody who's symptomatic with COVID-19 or you're symptomatic yourself. There is partial remote schooling that's in place, and we're at Open Texas Phase 3, which means that businesses are mostly operating at 75% of their capacity, and bars are open and allowed to operate at 50% of their capacity. This week, we're up to 33,391 total confirmed cases in the Coastal Bend with 29,643 recoveries. The active cases is currently at 2,886, and it's increasing ever so slightly, but it's essentially maintained at approximately the same level for the past several weeks. Moving forward, we're going to talk about the two winter holiday scenarios. One is scenario 1, where we have the transmission rate continuing at 1.13. That's the same as last week's projection. And I know the winter holidays are over, but we're so close to them that it's difficult to decipher between these two scenarios. The second scenario being celebrate like Thanksgiving 2020, where the transmission rate drops to 0.91 as it did surrounding Thanksgiving before returning again to 1.13. What these two scenarios look like in terms of transmission rate is this. So what you have here is a graph of transmission rate on the y-axis here, where 1 means a person who's infected with COVID on average infects one more person. That's what this dashed line means. And you can see the two models are the same until the winter holiday, where they deviate. So in scenario 1, it stays at 1.13 approximately before triggering the Open Texas Phase 3 to roll back to Open Texas Phase 1.5, where we go to 50% business capacities. That's projected to occur on January 13th, but that's equally likely, we're determining at this point, as the second scenario, which doesn't trigger a rollback of businesses at all, where the transmission rate dropped over the winter holiday and then returned up to previous levels before continuing to decline. You may be wondering, why are these transmission rates angled? And the reason why that's happening is because of the development of herd immunity. As more and more people become infected and recover, then those are people that presumably are not available to be infected again. Now, we know that there are examples here and there of people becoming infected a second time, but by and large, there's not a lot of those examples, and in the modeling, we assume that if you get infected once, you don't get infected again. So here's what the projections look like against the actual cases. The black dots are the actual number of COVID cases, new cases per day in the Coastal Bend, and then you have the peaked line, which is red, which is the scenario 1, where the transmission rate doesn't decline for the winter holiday, and then you have this other projection, which is for scenario 2, where the transmission rate basically dipped last week before increasing again this week to 1.13. So when you look at this, you can see why both scenarios seem equally likely, because it's very difficult with the data points that we have right now to tell the difference between the two. Now here you might say, okay, we have a lot of cases that occurred a couple days ago. I think everybody saw that 400 case day. But we've also had several low numbers of cases, and it's not just cases that we're looking at to know whether we saw an actual dip in the number of infections, or if we just saw a dip in the number of infections that were reported due to holiday delays. And that's the big question right now that we're trying to figure out. When we break down that last graph into each of the 12 coastal bend counties, you can see NUECES has many more new cases per day than the other counties and is increasing. Most of those 400 cases were in NUECES on the previous graph, this data point right there. And so I think that that's partially driving this really steep incline. We're pretty sure that those 400 cases were due to holiday delays in reporting as opposed to an infection phenomenon that occurred in all at the same time. And so we think that this may not stay as steep as more data points come in. We're going to zoom in on the rest of the coastal bend here. We have Jim Wells leading the other 11 counties, and it's getting up there with over 25 new cases per day. On average, San Patricio only reports their cases once a week, and so that's why you see these oscillations there. B County has a similar oscillation. I'm not sure if they're reporting only once a week, but that's possibly what's driving that oscillation there also. And the other counties are kind of staying level or declining. Oh, I want to back up to this slide. So this is something I think people should be aware of, and we do look at more statistics than we show each week, and as things become interesting or noteworthy, then we show them, and that's the case here. This is the new cases per day by age class per 100,000 people. It's a fancy way of saying that we've made it so the numbers are comparable amongst the age classes based upon how many people there are in each of those age classes. So what you're seeing is that in the 80+ age group, this is the age group that's the most susceptible to negative effects of COVID-19, there's been a fairly steep increase in the number of cases over the past couple weeks in that 80+ age group. And so this is something that you want to be aware of, and if you're 80+, you should most certainly be avoiding public areas, wear your mask, basically don't go to grocery stores and things like that. There's curbside, and if you can, or have somebody help you with that. Okay, moving forward to the South Texas metro areas. One of the larger developments here, San Antonio, is increasing fairly steeply, and if you look back at the summer peak, you can see that now the San Antonio has surpassed their summer peak. They're not quite to where NUECES was during the summer peak, but they're approaching that level now. Laredo seems to be going through a downtrend. You can see that their fall-winter peak was just about as high as their summer peak, and then the other counties that we're looking at are down below, with McAllen increasing fairly steeply over the past week or two. Looking at the whole state, if you look at the northwest part of Texas, which is the red and the pink, they peaked in the fall, and the number of new cases per day are declining. Whereas for the rest of Texas, the cases continue to increase. And it looks like places like Dallas, Fort Worth, and San Antonio here, the way this graph was made, are peaking, but most likely that's an artificial summit, and we expect that those are going to rise higher than they are now. Moving on to the hospitalizations, again, we're back to our projections with the scenario 1 projection projecting a peak in the number of inpatients in the hospitals in the coastal bend each day. versus the green projection, which is the scenario 2 projection, indicating that there will be a leveling and a very modest increase in the census number of inpatients in the future. Now, unlike with the case data here with the number of inpatients, for the past 5 days, there's a definitive downward trend, which is more supportive of the scenario 2 or the green projection here. Now, we've seen fluctuations like this before. You can just go back and look through this data and you can see rapid downward fluctuations before going back up again. So we're not sure, again, which of these two scenarios is correct, but it would seem that the green projection, which is slightly more favorable, is more likely when you look at the number of inpatients. Something that we're really paying attention to is the number of COVID patients in the hospitals. So this is this percentage, when the percent of staffed beds that are filled with COVID patients goes to 15% for 7 days. This is what triggers the rollback of business capacity or business occupancy from 75% to 50% of capacity. And so we're watching this. It looks like overall there's been an upward trend over the past couple weeks, but if you look in the past few days, it's dropped from 14% now down to 12%. And that's not surprising because we also saw a drop in the number of inpatients overall. So that makes sense with the last slide. Now the question is, will this start to increase again towards 15%, or will we decline and level off somewhere between 10 and 15%? That's the difference between the two scenarios. Moving on to the ICU, we're concerned about the ICU because this is the part of the hospitals that receives the most pressure. You can see that in the summer outbreak, where the number of COVID patients exceeded the average number of ICU patients before the outbreak occurred. Now, we've been on a long-term rising trend since we transitioned from 50% business capacity to 75% business capacity and bars open. And in the past few days, we've seen an increase in the number of patients that have been COVID positive in the ICU. Now, looking over the whole state, and what this is 1 day, it's yesterday's comparison of COVID to non-COVID patients in the ICU. So it's related to the last figure, but includes every trauma service area in Texas. And we're showing this in case you might be traveling or you may have family in other parts of Texas and you want to know how much stress is there, how much strain is there on the hospital system. We think that this figure is a good way to see that. The more red relative to blue, the more strain. The less red relative to blue, the less strain. And red are COVID patients, and the blue are non-COVID patients. And the overall trend that you can see is that in North and West Texas, there is more COVID patients in the ICU, percentage-wise, than when you go farther to the south and east, with the exception of Victoria. In the local area, we're doing fairly well compared to most of the rest of Texas. So for us here in the Coastal Bend and Galveston, essentially with the exception of us too, every other trauma service area has more strain on their ICUs. And this next graph is very similar to the last graph, except the last graph was for 1 day, and this graph is for the last several months, and it can show you the trend. And overall, when you look at most of the trauma service areas, you see an increasing trend in the number of patients in the ICU that are COVID positive. Moving on to fatalities, last week we talked about the evidence for a backlog. That evidence continues, where we see more plateau here than we would expect based upon hospitalizations and cases which lead fatalities. So it's usually our estimates of fatalities are fairly accurate. And right now we're at 862 in the Coastal Bend, but we think that this is a little low because the state is behind on counting the death certificates. In Nueces County, where there is not a backlog in counting the death certificates that we know of, you can see that this trend in the number of fatalities, the total number of fatalities, continues to increase. We're at 548 in Nueces. That's as of the Saturday report. We expect that while there's some leveling in the number of fatalities, and again here you can see this downward trend. This is from state data, and so because the state is backlogged, there's this kind of artificial decline right now, and we expect that for a given date, say, this is back in December, right now it's January, we expect that next week this line will be higher because more of the death certificates will have been processed. So we do expect the number of fatalities to continue to increase right now, and we don't see a decline in the rate of new fatalities per day, nor a plateau in the total number of fatalities. Okay, so in summary, regardless of which scenario is correct, we're fairly sure that the transmission rate is above 1 and the fall-winter outbreak is continuing. Now, we're unsure if there was a Christmas/New Year lull in the transmission rate where it declined before increasing again, or whether there was no lull and the transmission rate stayed high. It's difficult to discern between those two scenarios right now. As we get more data, we'll be able to tell that difference, and once we are sure of which model is correct or which scenario is correct, we'll update on our social media pages those figures. New cases are increasing, but hospitalizations are decreasing. This is some of those mixed signals that we get during these periods where we have holidays, where there may be a delay in reporting, along with a change in transmission rate, either higher or lower. Now, we were expecting that maybe the transmission rate would go lower because during Thanksgiving we saw evidence that the transmission rate declined. So we'll see if this slight downwards trend in hospitalizations is indicative of a larger trend in the infections that had declined over the holiday season, or if whether it was just this is just an anomaly and there was no change in transmission rate. The fatality data, again, are likely backlogged due to the holidays, and so we're not showing all the figures from the state that we normally would, and we're waiting for that data to get updated. And lastly, it's 2021, and while I know that we've emphasized that 2020 is not a normal year, 2021 right now is not a normal year either. And I want to wish everybody a happy new year, but I want to remind you that just because it's 2021 doesn't mean that you should let down your guard. Everybody should maintain their vigilance in trying to stop the spread of COVID-19, and that includes wearing your face coverings and social distancing. And I know at this point we're approaching, soon coming upon a year of knowing that the pandemic was here in the Coastal Bend area. For myself, we're rapidly approaching a year ago when I was telling my students in my class about the COVID outbreak in China. And here's the thing, if you haven't gotten COVID yet, when you do risky things and you come out okay, you start to think and get this false sense of security that, well, I've done it before, and while it was risky, I came out okay, so I'll probably be okay the next time. But here's the thing is, as you increasingly do risky things, your chances increase each time of a negative outcome occurring. So even if you are kind of tired of wearing your mask, you're tired of social distancing, and you're thinking, well, I haven't gotten COVID yet, so I'm probably not going to get it. It's not the way that this works. Every day that passes, you're more and more likely to get COVID. So please keep wearing your face coverings and maintain that social distancing. Hopefully, as new data comes in, we'll be able to update you near the end of the week and determine whether we saw a decline in transmission rate over the winter holiday. And I want to remind everybody that on Friday, at noon, we're going to have our Q&A session. So you can go to our social media accounts at CBCovid. We have a Facebook account, we have a Twitter account, and an Instagram account. You can post questions there that you have. We collate them, and we try to answer them on Fridays at noon with myself, Tiffany Anderson, Jason Lewis, as well as the NUECES the NUECES County Public Health Director, Annette Rodriguez. So thank you very much. I hope you have a safe evening, and we'll see you on Friday.